been in the innovation business for a long time, especially healthcare, over 10 years now. And I spent my whole 36 hours here at our headquarters here on the 24th. And even though I see startups all the time, I was absolutely, and I think that was the same for everyone here, it was absolutely energizing to see people that didn't know each other 24 hours before present a solution to a healthcare problem here with total strangers that they worked on for a day and a half. So,
Good afternoon, everybody, and thank you so much for joining us this evening, this afternoon, on being able to just learn more about women in science and the healthcare hackathon. My name is Jovelyn Castellanos, and I'm part of the core team and leadership team for the WISH hackathon this year. And it's a pleasure to be surrounded by amazing individuals who are truly wanting to disrupt healthcare. I work currently at Parkland Community Relations, and I am just very delighted to be here. WISH employs a creative method to solve health industry challenges. They convene teams and instruct them to use designated thinking to create changes, solve problems, and disrupt healthcare. Today, we have here Lindsay Settles, Lance Manning, who are both part of the leadership team for the Women in Science Healthcare Hackathon. We also have Melanie Hewlings, who is a prior hackathon participant, and she is also a senior clinical data manager at TrialSpark. So I'm very excited, very honored to be surrounded by these amazing individuals, and thank you for your time this afternoon. I'm going to hand it over to Lance as we continue with the program tonight. Thank you.
Thank you, Jovelyn, and welcome everyone to this information session for the WISH hackathon that will take place this Friday and Saturday. We're excited to have you. I know that we'll probably have more join us in this session, and we look forward to meeting you and to take any of your questions and really to give you an overview of this event, whether you're a first timer to the Texas Healthcare Challenge or you've joined us before for some of our events. So I'm going to go through a couple slides, and then we'll hear from our speaker, who is Melanie Harris. So Melanie, which we'll introduce here in a minute, is a clinical data manager at TrialSpark, and she's also a prior participant in our events. So Health Wildcatters, if you're new to this group, this is our sponsoring and main entity that we're a part of. Health Wildcatters has been around almost 10 years, and they have funded over 150 healthcare startup companies who have gone on to raise over $150 million. And it's a great program for those of you who want to start businesses and get them funded. Every year they have a cohort that plugs into the accelerator, and those companies get funding and get launched into their commercialization track. So check us out, and we're happy to tell you more about that. We also want to note that there's this banner at the bottom of the screen shows the website of the event and also the social media hashtags and Twitter feeds where you can get more information. I do want to say something briefly about the SBIR and STTR programs. So the Small Business Administration, SBA, is a main sponsor and co-funder of the Texas Healthcare Challenge event, specifically the Women in Science and Healthcare Hackathon. We want to recognize them and also promote that over the next few months, we will be holding educational sessions for our WISH Hackathon participants and also for the entire community connected to Health Wildcatters to encourage female participation in the federal grant program known as SBIR, or Small Business Innovation Research Grant Program. This is non-dilutive funding that companies can win to get their technology, their R&D project off the ground and get it commercialized. Non-dilutive funding means the government grants this money. There are no major strings attached. You don't owe them the money back, but it helps to get new ideas out there. In fact, they call themselves the America's Seed Fund. So as part of this program, we will be holding some information sessions over the next few months to talk about the different federal agencies that participate in SBIR. And we will be featuring some guest speakers, and also we will have a group of female mentors to help the participants ask questions and learn more about this program. We're just going to put a placeholder here so you can think about this now and as the event nears and as you can participate after the event. So this information here has the pathway that makes up the healthcare hackathon or a healthcare challenge. And what is it made up of? Well, we get together on a Friday night, and people who want to solve a problem in healthcare or have a challenge that they're facing, they share that problem statement. It's a 60-second statement that they share in front of others. Now, I will say that we do have a virtual element to our event this weekend. So you can participate in person or you can participate virtually. Either way, you can pitch your problem statement, and then people after that will talk to you about possibly joining your team or solving the same problem. So there's time when those people get together, they will either meet up in person or virtually and create a team. And that team over the next 24 hours comes up with a presentation or a solution to that problem. And that solution will be pitched at 5 p.m. on Saturday, the following day, to a panel of judges. And those judges will assess the merits of that solution and the strength of the team and the strength of the idea, and award prizes to a first prize winner and other finalists. We will also likely have a prize for the best use of AI or artificial intelligence in your solution, and also provide you with a winner who's the best or the biggest social media impact team that uses the hashtag #Wish2022. So that's what a healthcare challenge looks like. We've run these events since 2019, and they're a lot of fun. It's a great way to get together and meet other people and hack and come up with solutions. And of course, the prizes. We do have some gift cards available for those who want to pitch early. We have an online forum in a system called Discord where you can pitch your problem statement before Friday night. And those who do so will be in a drawing to receive some gift cards at the event. So we are taking some precautions with COVID. This is one of the reasons why we decided this last Thursday night to open the registration to virtual participants. So you can show up in person, but you can also attend virtually. Those who attend in person on our 20th floor office in downtown Dallas will be asked to show a negative COVID test, either PCR that they've taken on their own, or they can take a rapid test prior to entry. If they do test positive, they have the option of taking a bag of swag or nice goodies, and then they can participate virtually. So we hope that's not the case, but we do want to make all precautions. In fact, we do recommend masking upon entrance, and we're obviously taking the cues from our local and state government and federal government on any restrictions. But currently we can still meet, but we do recommend masking. All right, well, let's go ahead and turn the time over to Melanie, who's a friend of our event. She's been involved in many of these, and I know that it's been interesting in her career to be, one foot in the research mode and one foot as a aspiring entrepreneur. But we've known her for a while. She has a good history with UT Southwestern, locally here in Dallas, and has attended a few of our events. So the way that this will go is she's going to share some of her experiences. We're going to leave the floor open to questions after. We want to answer any of your questions related to the event. And as we get to that, I will cue the audience to either chat or raise their hand. And you all are in the picture. You can see each other, and we'll let you speak and ask your questions. So with that, Melanie, I'll turn the time over to you, and I'll stop sharing.
Sure. Thanks, Lance. Hi, everyone. I'm Melanie. And like Lance and Jovelyn mentioned, I have experience both at large academic medical centers and startups. I've kind of bounced between academic research and tech startups over the last 10 years, since I'm always interested in how we can improve healthcare, but also love just being on the ground, making things happen. So right now, like we mentioned, I'm a data manager at a clinical trials technology startup based in New York. But I'm also based here in Dallas, and most recently worked at UT Southwestern for a few years, managing the breast cancer research team. So a lot of what I do in clinical research is apply better technology to try to streamline this process, to bring treatments to patients faster and more efficiently, which happens to be the mission of the company I'm currently working at. So obviously, we all know there's a huge need in healthcare to improve access for patients and just quality of care in general. And there are a lot of new startups forming around apps and technology that's working to advance things and make things more accessible to patients. But right now, I think we're really at the point where there's an influx of companies and a lot of great ideas that people are working on, and a lot of new technology that still needs to be applied and figured out. So all of that research is really being brought to the patients directly. So when I moved to Dallas 3 years ago now, I wanted to get plugged into the healthcare tech community here, and was so happy to find the Health Wildcatters. It was right around the time of the second hackathon event in the summer of 2019. So I participated in that healthcare challenge. And then the first Women in Science and Healthcare Hackathon was February 2020, which seems like a long time ago now, but was almost 2 years ago. And I was actually on the winning team for both events, which was really exciting. And we had some really great groups come together. So for both hackathons, the ideas really didn't come until later on Friday night, but really we just all were working on the same problem that we were really passionate about, and both of the problems that I gravitated towards were ones that really focused on bringing healthcare directly to patients. So at the first hackathon, I didn't pitch, but actually Karine, who will be one of the mentors at the event this week, and at the time was doing genetics research at UT Southwestern, and now is at I think a cell transfer company in Houston. So she had pitched an idea, just a basic problem that as a researcher, she saw that patients had a hard time finding clinical trials that were available to them, which, I mean, I've been working on this problem for over 10 years now, and it's a huge problem. And we we had a really unique group come together with someone from health insurance, different researchers across UT Southwestern, me and another more healthcare operations person came together and pitched an app for how to bring this information to patients and make it automatically search against available clinical trials. So at the time was a really cool idea. There's actually been probably 10 to 20 companies formed around this idea since then. And I think they're still working on it. It's a huge problem space. So, we kept meeting, but obviously that was a really hard and competitive space to think about launching something in. And then at the second event, I decided to pitch. It was the first Wish hackathon, so it wasn't as intimidating. And Avery, who will be at the event, was actually one of the mentors who helped me really narrow down what I was going to say. Like, you can pitch any problem just in one sentence. And I think people really gravitated towards this problem where I just described how the patients at UT Southwestern were traveling such far distances and spending really long time, sometimes a whole day at the medical center just to get their treatment, especially on clinical trials, just something I've experienced for a long time. And from this, we had a really unique group come together, an anesthesiologist, someone in marketing, someone who did, I think, diabetes research. So, and I'm a type 1 diabetic, so very familiar with technology in that space. So we came up with a concept of mobile treatment called cancer cruisers. And I think there's been a lot of hackathon ideas around mobile treatment, and it's obviously another area that's really hot for business right now, especially with COVID. So that was, we wanted to take it on the road and take treatment on the road. It was February 2020, so probably not the best time, but we kept hacking and thinking about it and learning about business. And it's just been a really great experience to have these groups of people that I still keep in touch with. We're connected on LinkedIn. We're, always, I think one of my team members actually ended up starting her own company. She'll be at the event as well, Patricia. So it's just been a really great network and really exciting to meet all these different people. And what I love about these hackathons is that these problems seem so obvious to me, but then actually solving them and thinking about how to do that in a scalable way that makes money and can build a business model is a totally different skill set and something that I've been continually learning. And it's just an amazing experience to work with people from all different fields who bring totally different ideas and perspectives and skills, and learn from each other and bounce ideas off of each other, and just really, put together a cohesive idea and really quick presentation. That 2 minutes will go by really fast, and it takes a lot longer than you think to put together a couple of slides in a 2-minute presentation. But we really encourage all of you to apply if you haven't already, and we'd just love to have all of your unique experiences and ideas at the event. The more diverse, the better. So I'm happy to answer any questions, and that's just been my experience, and I'm excited to continue to help with these events.
Great. Thanks so much, Melanie. Okay, well, let's open the floor to any questions. I am going to do a share screen on our FAQ page, and I'll ask Jovelyn to post this in the chat so that you can look at the questions, and maybe that can jog your memory. So let's just go ahead and start with the first question here. Raised hand, Marilyn Harris. Do you want to ask your question?
Sure. Hi, everyone. I'm Marilyn Harris. I am a nurse out of Houston, a nurse that has pivoted to healthcare cybersecurity. That in itself is an interesting conversation. My question is, thank you so much, Melanie, for giving us some insight into how this is going to work this weekend. Last year, I had the honor of pitching at Nurse Pitch at HIMSS, the national conference, and I also pitched during Nurses Hack for Health. So it's been an exciting time. I'm glad to see so many healthcare providers involved in, hackathons. I mean, who would have ever thought? My question to you is, you talked about your first and your second experience with this competition. When you went each time, what was your goal? Did you just want to join an interesting team, or did you have an idea that you wanted to pursue yourself, or both?
I think for me personally, I didn't come into it with any preformed idea. It was really just I happened to pitch the second time, but really what I really like about these hackathons is the pitches are really focused on a problem that you're coming together, and then you kind of pool ideas to come up with that. So I didn't come in with any, kind of business idea to work on specifically.
Thank you.
Great question. And, I think our motivation for people who will participate is to come with a problem statement, think about the problem you're trying to solve. So this last person who had a question asked about, she's done this before and should she participate again? And I'm actually curious, and I'm looking forward to meeting you. What kind of problem are you solving with the data security piece as a nurse? And that's great. So you don't have to respond right now, but very interesting. All right, so we have another question. Shruti Amre, you have your hand up. Or no, I have my cursor over that person's name and call on them for them. So sorry about that. Anyone else have a question? While you're thinking about it, I do want to give a brief overview of some of the things that you can think about as a participant. So we opened the virtual sign-up sheet for this event on Friday. And this is what this means. If you are out of town and want to attend, you can attend. And the way we'll do that is we have a virtual platform on a system called Discord that you can log into, and between Discord and Zoom, you can participate virtually 100%. You'll see our presentations on Zoom. You'll meet other people on Discord. The people who problem pitched will be seen on the Discord channels, and you can talk to them. And then once your team is formed, you will have a locked channel on Discord, and you can iterate with your team, who will all be virtual. And then we will also have a number of mentors who will check in with you periodically to see how you're doing. Now, for those who have been on a Zoom call for more than an hour, you know that it's tedious. So during the week for our virtual attendees, we don't expect you to be online for 24 hours. Obviously go at it for an hour, take a break. It's tough to be involved in something so long on Zoom or virtually. For those who are attending in person, again, we have a testing system where you will either show on your phone a negative COVID test taken in the last 24 to 48 hours, or you can take a rapid test at our location. So we're just trying to make all precautions to being up on our 20th floor. We'll have probably about 40 to 50 people, and maybe even more than that virtually. So any questions about that process of registration, acceptance, getting into the event, or virtual or physical attendance? Veronica.
Hi, nice meeting you. And thank you for this opening up the, floor. It's very informative. I'm a grad student in neuroscience, studying pain and stress at University of Texas at Dallas. And I do have a couple of questions. My first question is regarding the rapid test. Is the kit going to be provided at the site, or do I have to purchase it, or am I bringing the rapid test kit? Or
we have the rapid test kits, so
okay.
You show up and we'll process you through that.
Right, thank you. My second question is, first of all, thank you, Melanie, for sharing your experience. This is very grateful for me because I'm a little bit intimidated as a grad student. So what's the expectations for this making a team and also getting a presentations? Are you guys expecting like a business model that's like already ready to be commercialized, or like what's your ideal expectations? In my second question. And I think it's going to be more directed to Melanie. Like, can you share an experience, like how to find your team? Because I'm a little bit intimidated because I feel like I'm going to be only grad student there coming up, and I'm trying to see, find some of the experience in my first experience with you guys. But at the same time, I do want to participate fully so that I can get most out of it. So like if you can share some of your experience of like how to find your team, and also like what could be done to get most out of this 2-day session, would be great.
Sure. Do you want me to start with the second question, Lance? So I think in terms of finding teams, so the last event we did fully virtually, and then before that they were in person, and both times I feel like the teams just kind of naturally form. We try to run it on Slack, and if you'll see people pitching problems and can just get into group conversations, the same thing happens in person where you just kind of go over to the person who pitched, or if you pitched, people literally will come running up to you and tell you about like this idea they have for your problem. So it all kind of happens fast, but very naturally, and I wouldn't be intimidated about that. And there are a lot of grad students. I think a lot of people come to this looking to learn specifically about how to translate healthcare backgrounds into business. So it's a really good learning experience around how do you come up with a business model or a pitch deck, and we'll have a slide, kind of a slide deck template. You can only get through 4 or 5 slides in the 2 minutes. So it's certainly not a full fleshed out idea. Lance, if you want to speak more to that.
Yeah, I think you asked about, is this business presentation going to have to be top notch? You want to impress the judges. So graphic design, the professionalism of the presentation. Hopefully you or someone on your team is okay at public speaking. That's all that needs to be done. And then you actually have 3 minutes to pitch your presentation, and you have 2 minutes of judge overview, or they'll ask you some questions.
Mm-hmm.
So the mentors who will be supportive of your team can assist you in crafting your value proposition, your target market, your competitive analysis. We even encourage teams to get onto medical Twitter, ask people different questions, do some research. But we'll have a support system to help you craft your final presentation. Hopefully that helps.
Yes, it helps.
Okay, great. Well, good luck. We look forward to seeing you there.
All right. Thank you.
Thanks. Okay, anyone else have questions or comments? You can just go on to video share, or you can raise your hand or ask something in the chat. While we have people thinking about that, I do want to mention that we have various track topics that if you go to the website, some ideas on categories where you could pitch a problem statement. And I'll mention a few of them here. Women's health, AI in healthcare, improving access to care, mental health, COVID-related innovations. I know I also wrote a blog recently that I posted on the webpage here about other areas that are a high priority. There's a initiative from the U.S. administration and the vice president talking about maternal health. As the U.S., we are, I think, ranked 17th in the world in the health of mothers after childbirth. We also have, I think, the Surgeon General making a statement about teenage mental health. We've seen COVID make an impact to our health and our mortality population-wise around the world, but also they call it the second tsunami of healthcare problems, and that is mental health of everyone, teenagers, adults, those in the healthcare industry. I had a doctor friend recently post some frustration on Facebook and just, express that, there's a lot of frustration going around with the second wave. And, anyway, so, there's great opportunities for us to be involved in this specific time. Anyone else have any questions, or Melanie or Jovelyn, anything else we want to add? If you do have a question, just raise your hand or turn on your video. I think Lindsay, thank you. She listed in the chat some of the links there. We'll pause for a second if anyone has questions.
Hi, this is Lori Barenblatt. I wanted to just ask a question. I actually participated in 2019 and it was fun and awesome and I loved it. My experience was similar to one that Melanie described. Like I went there just planning to take it all in, participate, join a team. And then Avery actually convinced me to pitch something and I ended up having my own team and everything. My idea was, something that we just came up with spur of the moment, getting your 1 minute pitch together within that hour or something and putting it out there and then trying to come up with solutions the next day. Several other groups were doing things that they've worked on before, so like their presentation, like literally had financials or like things that they know they've been working on this pharmaceutical product or something for months or years. Is it still like that, or are there any more guidelines to kind of, I thought the spirit of the event is more of the hackathon, like just really thinking of stuff, but there was a decent mix of more established things compared to coming up with ideas on the spur of the moment.
Yeah, thanks, Lori. That's a great question, and glad that you were at a prior event. In terms of our participants and registrants, we do ask that whoever pitches a problem statement that they don't include any solutions. So it may be something that they've thought of before, maybe something they're working on, or perhaps they're in a company that's working on something. We give a little bit of I might call it a handicap in the judging process to people who pitch their own company, if you will. Now, we don't have any prohibitions of someone from a company coming. We find that to be a little bit problematic, but we do want all of the participants to know that we judge teams on some of those factors. So, if you've done a year's worth of financials and you show it, the judges are going to take that into consideration. Really, they want to judge the solution on its uniqueness, on the innovativeness of it, and its applicability. So, many of our teams, most of them, are people who just ideate on site. So it's rare that we have a team that's its own company, if you will, win something, but it does happen. And, we want to open it to everybody, but we try to level the playing field out, and we don't want to dissuade anyone from attending, and hope that might motivate you to attend again. Melanie, anything to add to that?
Yeah, I think that one event there were some companies that already had been, working on their problem for a while, but there have been less of that and more recent events, especially with the remote ones and having, more people who are not location restricted anymore. It's been more organic, I guess.
Oh, cool. Thank you, guys.
Thank you, Lauren. Anyone else? Okay, I'm going to do a share screen and show the schedule just to go over that real quick for some of our attendees. Give me just a second here.
Oh, we do have a question in the chat from Marilyn about how many teams pitch. Do we have a target number for this event?
Do you want to read the question? It's how many people?
She just asked how many teams pitch.
So we normally have, in a regular event, we have between 20 and 30 people problem pitch. That means at the start of the event, they say, hey, I want to solve this problem. We probably end up having between 12 and 20 teams in a normal event. So the number of people that pitch don't always form a team. Sometimes they'll merge with another person who pitched, or maybe there's just not a lot of interest in it and they join another team. So yeah, I'd say depending on our numbers, I think our minimum has been about 10 for I think it was 9 for the virtual one. And then it was probably 18 for our first event, which was the most. Does that help? Okay. Well,
Yes, that's exciting. I'm going to go virtual. First, I was going to come to Dallas because I'm in Houston, but I said I would just do virtual.
yeah, that's cool. So here's our schedule. We have a check-in and a kickoff time of 6 p.m. This may change up a little bit with our testing process. We're going to make an announcement this week where we'll likely have people come in early, if possible, at 5. And then we'll try to shoot for our kickoff at 6 p.m. We'll have a presentation from some of our MCs and some other speakers. And at about 6:45, we will begin the problem pitching section. And so between then and between 7:30 and 8 o'clock, that's when teams will form. They'll do some iterating that first night and make sure they're formed and they're good to go. Most teams will be between 4 and 6 people. We discourage larger teams, and we think that between 3 and 4 is a good start, but 4 and 6 is a great number. The next day on Saturday, we'll kick off at 9 a.m. We'll have a breakfast opening at 8, and then teams will continue to work through the noon break and then till 4 p.m. 4 p.m. is the tech check. That's when you have to be all finished and submit your presentation. And then we'll have the final presentations at 5. We'll have the judges view those. We'll do a dinner break at 6:30. And then we'll have the winners announced between 7:30, 8, and 9. So it's kind of a long day, but it's a lot of fun. A lot of great things going on, and hopefully you'll have a good time with it. So yeah, that's the schedule. Do we have any other questions?
Hi there. I'm Sumeda Mangia. I'm very new to this. And my question is it like you're developing a solution during the day on Saturday, like actually building something, or is it just like building like a business plan or a model? Or
Melanie, you want to take that?
Sure. I mean, it can be either. It's not a ton of time, but usually if there's someone on the team who is really tech savvy and can mock up like an app or something, the more proof of concept you have, the better. Like I've done some data analysis or used some IBM Watson tools that day, but really the goal is to just come up with ideas and the concept and get as much of like a proof of concept as you can done. But really you're pitching the summary of your idea and your slides and the concept around that, the business model, financials, that kind of thing.
so do you guys form the teams or do we form the teams?
You'll form the team. So when someone pitches a problem, you can reach out to or go up to them if you're interested in working on that and talk about potential ideas that you have and your background and what you think you can contribute to the problem.
We can also help teams form. So let's say you're trying to find some team and we know your background. We would say, oh, hey, talk to this team. They're trying to solve this problem. So some of the mentors and leaders can help and assist people join teams. So don't worry, show up. You'll find some team to join, and there's a lot of chaos, but it turns out to be a lot of fun.
And did you do this once a year, or is it something that like a program that's offered many times throughout the year?
We started in 2019 and held one in February and one in August. That's the only year we've done 2. Then 2020 we did one, and then 2021 we did a virtual one. So far it's about 1 a year, but sometimes we may do 2 depending on interest in the schedule.
And my last question, sorry, I think, Is there a deadline to sign up for this?
The deadline was Friday, but it's been extended because we have opened the virtual application. So between now and Thursday, 5 p.m., that's the new deadline, Thursday, 5 p.m.
Right.
You can attend in person or virtually.
Great. Sounds wonderful. I'm not tech savvy. I'm actually a physician and an entrepreneur. So I've been a part of 3 digital health startups now, and kind of looking for just other things like solving healthcare problems, and through innovation, and is something, it's a passion of mine. So this is really exciting for me.
Yeah, well, we look forward to having you. And again, back to the question about, do we need to come up with a workable solution? It's not enough time to really do that. Like Melanie said, you can design some mock-ups. You don't necessarily have to code anything. What we're really looking for is business models that will be very innovative. And so, you can come up with that with a team of a few people and mentor feedback. And that's really what we're looking for. And the deadline forces you to present something that's compelling, and not just, oh, hey, there's 30 other companies trying to do that. So, that's the angle on it.
And I'm sorry, because I did jump on really late. Do you have judging criteria on the link that you put it in the chat?
I think we have that on the front page. So if you want to look through that, we'll also have that throughout the event, and we'll go over it Friday night. So teams will know exactly what the judges are looking for. Great. Well, thanks for those questions. Anyone else? So in the chat, you can see some of the links. I would visit that before we sign off. I would also recommend that you look for the updated FAQ list. We will be posting a lot of things on social media, so take a look at us on Twitter and on LinkedIn, and check your email. If you have registered, you'll get a notification if you've been accepted, and we'll also be keeping you up to date on any pertinent announcements related to registration, or the virtual, or the in-person participation. One note on the virtual platform, it's called Discord. For those who've been accepted, you will be receiving a link in the next day or so where you can log in early and get familiar with that platform. Discord, before it had been used for online things, I think it was pretty popular in watching other people play video games or something. So if you have teenagers, if you're around teenagers, it's a pretty cool system out there that allows for people to interact virtually. Lindsay's posted the judging criteria and FAQs. Thank you, Lindsay. Go to the chat for that, or go to the website. All right, Melanie, Jovelyn, any other thoughts or comments before we finish up for tonight?
I just want to say, I've attended virtually and in person now, and either way, it's a great experience. And sounds like you all have really great, backgrounds that would definitely be a huge asset to any team.
And no additional comments from my end. Lance, very excited, like Melanie said, to see all of you there virtually or in person, and we hope to see you there. And if you have any questions, like Lance said, you can keep a close watch on our social. If you have Instagram, Facebook, LinkedIn, or Twitter, we're active there. So very excited, and we hope to see you this weekend.
And one other announcement, we also will have another guest speaker tomorrow night. Her name is Jane Herndon, and she is the CEO of Sovereignty. She was actually in the Health Wildcatters Accelerator program this last year, and she's got a great story of how her company found funding through a federal agency and has been able to find some really good success so far. So we'll hear her perspective on starting a company as a female entrepreneur, and also in the SBIR federal grants program. So that's tomorrow night at 7 p.m. once again. So we look forward to seeing many of you join that event as well. Okay, well, thank you, everyone. Have a nice evening and hope to see you all this weekend. Take care. Bye-bye.